Well, the World Stroke Day 2023 is observed on the 29th October every year. And to educate us more on this, we have in our studio Dr. Nkechi Obianozie, a consultant neurologist, University of Abuja Teaching Hospital, Abuja. Very warm welcome and nice to see you again. It's over a year we discussed similar matter, right?
Yes, thank you for having me.
Now, tell us what improvements, have been made universally in prevention of stroke or its management.
Well, in general, worldwide, stroke mortality has been falling and incidence. But this is in sharp contrast to Africa and Nigeria, where we're having rising incidences. So that means that we're having more and more people.
Why?
Well, it's, first of all, we're living longer. So, we have an aging population higher than we used to have in the past. Then also other things like what we call epidemiological transitions. So we'd have more sedentary lifestyles.
I would always want you to break it down, for
yes.
our audience, so that,
yes. So we're sitting down more, we're eating more unhealthy food, and we're getting more hypertension, more obesity, less vegetables, and all those things, exercise and things that were protecting us before when we were more active, going to the farm or having, more active social lives, not as sedentary as we are now. And for us to avoid, stroke, because when you look at the statistics, 1 in every 4 at XYZ age is likely to have it. Exactly.
And when that happens, there's a percentage, about 40%, don't survive it after 30 days and the rest.
Yeah.
So we're not doing really good in its management, or is it a case that the situation would have really gotten bad, really terribly, because of the sedentary issues you mentioned? Where, how does stroke emanate from?
Well, stroke is a brain attack when there's either there are two things that can go wrong. Either a blood vessel ruptures, and so it now kills the brain tissue, or there's a blockage in the vessel. So that's what we call ischemic. The one is the blockage, or the other one that's ruptured. But we found that the main contributing factor to stroke in Africans is actually hypertension worldwide, but even more so here in Africa. So from the studies that we have within Nigerians and West Africans, we saw that 90.8% of what they call the population risk is just from hypertension alone.
So, and from what age bracket would you want to situate that?
We are seeing hypertension even in teenagers. So from 25 and above is usually when we start to say that the risk now becomes 1 out of 4. And the fact is that half of the people with hypertension don't even know that they have hypertension. So, and then
why is this such a hidden disease, I would ask? People want to know. Why wouldn't people really know?
Because hypertension has no symptoms. You can only know if you go to check. You can only know if you go and you actually have someone check your blood pressure. So those myths that, I have a headache, it's when I have a headache I know my blood pressure is high, are quite obsolete. Hypertension basically only has symptoms when it begins to have complications. So that's really the reason, because and we're not doing enough screening. So maybe people think that when they ask them for pre-employment screening or going to university, you're supposed to do like a fitness check.
Oh, yeah.
Some people just say, just sign the form for me, doctor. They don't understand the importance of those screening tools to pick up the people who require blood pressure medications before they actually get any complications.
Complications and the rest. And can complications arise from diabetes, liver, kidney problems and the rest, apart from, the blockage of airflow or blood vessels in the brain?
Okay, like the risks, kidney disease is definitely also a risk factor for stroke. Diabetes is a risk factor for stroke. And then we mentioned all those other things like sedentary lifestyle, of course, hypertension. And then cholesterol, people who have high cholesterol levels have been found also to be at increased risk of strokes. So all these, sometimes it tends to maybe play an accumulated role, but we still like to emphasize the most. And then cigarette smoking, people who smoke Indian hemp or use any sort of recreational
that are
drugs.
being legalized in the Western world, Indian hemp, that it's medicinal. Is it a problem here? Is it a risk factor to stroke?
Yes, established risk factor, both for ischemic stroke and hemorrhage, the two types of stroke. So it's been found that Indian hemp, both when you eat it and when you smoke it, just like cigarette smoke, is a risk factor for stroke. And then we mentioned other recreational drugs, crystal meth, that's ice, methamphetamines, people who use cocaine.
Some, they call them colos and the rest.
Exactly.
Now, well, you would know more about that because of the patients you see in the hospital.
Yes.
So, but look at the irony, you know. Medicine sometimes can be very funny. You know, it can put syllogistical arguments, and you wonder, why is, you know, Indian hemp, for example, being allowed in some states in the US? In Canada is legalized, I think in one or two of the Nordic countries and the rest. And yet you're telling our viewers now that it's a major risk factor too, or one of the main risk factors to having stroke.
Well,
how do you reconcile this?
Difficult to reconcile, but we here in Nigeria, thank God, those drugs are not legal. So we just have to keep telling people that these are the risks, whether it's cigarette smoke, whether it's Indian hemp, whether it's whatever recreational drugs, whether it's alcohol you're drinking, you're also increasing your risk for stroke. So I think that we just have to keep emphasizing the message that even though perhaps some people are, you know, touting these as safe things to do, that they do have their risks, especially from a stroke and cerebrovascular disease point of view.
Yeah.
Yes.
Yeah. Thank you so very much, Dr. Nkechi Obianozie, neurologist, University of Abuja Teaching Hospital. It's always a delight to have you.
Thank you for having me.